A bad headache. We've all had them, right? You pop a painkiller, maybe lie down for a bit, and usually that's the end of it. But what if it isn't? What if that headache is actually the very first clue in a high-stakes medical detective story? Today, we're going to dive into a case where a really common symptom was actually masking a brain emergency, and doctors were in a race against time to solve the puzzle.
And that's the exact question at the heart of this story. It's about a 19-year-old student who we'll call NZL. She walked into a hospital thinking she just had a terrible headache, but she was actually in the fight of her life. Her story is just an incredible reminder of how complicated and surprising the human body can be. So let's meet our patient. She's 19 years old, a university student, just getting started with her life. But this really baffling illness just brought everything to a screeching halt. And it all began with a list of symptoms that went way, way beyond just a simple headache. Yeah, see, this was no ordinary headache. This was a severe, relentless pain that was spreading down her neck, even into her spine. On top of that, she had a fever that kept coming and going, dizziness, drenching night sweats. She was losing weight without trying and couldn't even keep food or water down. When you put all that together, you're not looking at a migraine anymore. You're looking at clues that something is wrong with her entire system. So when she gets to the hospital, the medical team notices something else right away, something really concerning about her mental state. They described it as apathetic. And that doesn't just mean tired. It means she was emotionally flat, kind of indifferent, not responding like you'd expect. For doctors, that is a massive red flag. It's a clear signal that whatever this illness is, it's affecting her brain. All right, so the situation is obviously serious. The doctors jump into investigation mode. And the very first step in solving any medical mystery is a thorough physical exam. They're looking for any tangible physical clues that can point them in the right direction. And they found a big one. During the neurological exam, they found that she had a really stiff neck. Now, that might sound like a simple thing, but in medicine, when you see a stiff neck combined with a fever and a change in consciousness, that points like a giant flashing arrow to one specific place, the protective layers around the brain. So here's why that's so important. A stiff neck is what doctors call a meningeal sign. The meninges are these thin protective layers, kind of like blankets, that wrap around our brain and our spinal cord to keep them safe. When those layers get irritated or inflamed, it causes that classic painful stiffness in the neck. This one physical clue told the doctors exactly where the battlefield was. Okay, so they've zeroed in on the location, the meninges. Now the real hunt begins. What or who is the culprit? The team had to turn to more advanced tools, things like imaging and lab tests, to try and identify the invader that was causing all this dangerous inflammation.
The next logical step, and you've probably seen this on TV shows, is a CT scan of her head. It's basically a super powerful X-ray that gives you a detailed 3D picture of the brain. They were looking for the obvious stuff, a tumor, any signs of bleeding, or major swelling, something they could see. But then the results came back, and get this, completely normal. Nothing. No tumor, no bleed, no obvious cause for how sick she was. This was a huge setback. The one test that should have given them answers just made the mystery even deeper. If the problem wasn't something big and visible, what in the world was it? So you can imagine the doctors scratching their heads. They knew her brain was under attack, but the scan was clean. This told them the enemy was likely microscopic, some kind of infection. But where did it come from? The search had to get a whole lot wider. Since they couldn't find the source in her brain, the doctors broadened their search, looking for an infection anywhere else in her body that could have spread. They ordered a chest X-ray, and this is where the case took a huge turn. The X-ray showed what they were looking for. There were these patchy spots, or infiltrates, scattered all through her lungs. Now, to you or me, that might just look like a blurry image. But to a doctor, that pattern is a classic sign of a serious lung infection, and one suspect immediately jumped to the very top of the list: tuberculosis, or TB. All of a sudden, all those other symptoms, the night sweats, the weight loss, they all started to click into place. Now, TB was the prime suspect, but in medicine, you need proof. You can't just go on a hunch. So they used a very powerful, high-tech test that actually looks for the DNA of the tuberculosis bacteria itself. It's like a forensic test to find the culprit's genetic fingerprint. And there it was. The results came back positive. A trace of the MTB, Mycobacterium tuberculosis, was detected. That was the smoking gun, the definitive proof. The mystery was over. They had finally unmasked the culprit behind her entire illness. So the final diagnosis was tuberculous meningoencephalitis. I know that's a mouthful. It's a terrifying name for a really terrifying condition. But it raises a huge question, right? We think of TB as a lung disease. How does it end up launching a full-scale assault on the brain? First, let's just quickly break down that big word. Meningo refers to the meninges, those protective layers we talked about, and encephalitis means inflammation of the brain tissue itself. So this isn't just an infection around the brain. The bacteria had gotten inside the brain, which is what makes it so incredibly dangerous. So how did the bacteria make that incredible journey? Well, think of it like a stealth invasion. It all starts when the bacteria are inhaled into the lungs. From there, a few of them manage to escape and get into the bloodstream, traveling all over the body. Now, the brain has this amazing defense system called the blood-brain barrier. It's like a fortress wall. But these TB bacteria are sneaky. They find a way to cross it. Once they're inside, they can form these tiny little pockets of infection that can eventually burst, spilling bacteria all over the brain and triggering that massive life-threatening inflammation. So now the doctors knew exactly what they were fighting. The enemy had a name. But for this young student, getting the diagnosis was just the start of a very long, very difficult road back to health. And that first week in the hospital was an absolute roller coaster. She actually got worse before she got better. By the second day, she was agitated, her speech was rambling. And then on day 5, the inflammation in her brain caused her to have a seizure, a really serious complication. But crucially, on that same day, the doctors started the anti-tuberculosis therapy, and that was the turning point. By day 8, the drugs were starting to work. Her condition finally began to stabilize. Her treatment plan was basically a full-on counterattack. It wasn't enough to just kill the bacteria with a powerful cocktail of drugs. They also had to manage the damage. So she was given strong steroids to bring down that dangerous brain swelling, medication to prevent more seizures, and just all-around supportive care to manage her fever and pain and help her body finally heal. So what's the big lesson from this incredible case? It's that a symptom, even a scary one like a severe headache, is just the beginning of the story. The real detective work is finding the root cause. Her problem was in her brain, but the source, the real villain, was hiding in her lungs all along. It just goes to show you, without that persistence, without connecting all the dots, the outcome here could have been tragic. Getting the right diagnosis is everything. And that leaves us with a pretty powerful thought to end on. This student's entire ordeal started with a headache, something millions of us get and just brush off. It really makes you wonder, doesn't it? How many other serious conditions out there might be hiding behind symptoms we're tempted to ignore every single day?